I'm Will, and my next video is going to be on Leukotape and how to use it for splinting, sprains and strains, and using it for blister care. In my last video you saw I did one on moleskin on blister care, and this one I'm going to continuation of that, and also then go into how to treat sprains and strains your ankle in the backcountry. So what we're going to start off with basically is how do we treat blisters with Leukotape. What I've done here is I've already cut this to save time. I'm simulating a blister on the back of her foot here, large, avulsion to the back. It's common a lot of times when the back of the boot gets loose and you don't have them tightened enough, and it'll cause a blister. Now, the first thing you want to do if you have a blister and it's bubbled up like a big mound with a lot of liquid in it, you're going to want to pop that blister. Not pop it, but you're going to want to take a safety pin like this, and you can either sterilize the tip with a Bic lighter like I've got here, heat it up before you poke the bottom side with just one hole, or you can use Bandage wipes, iodine wipe, or alcohol to sterilize this to do it. So if you've got a large blister that does have a big dome on it, you're going to want to drain it before you place the bandage on it. The next thing I recommend that you do is clean the area first. Now you can clean it with alcohol wipes all around. You can use moist towelettes, hand sanitizing towelettes, anything that you have in the field. I carry a little bit of everything in there to do that. But what I recommend mostly is the iodine. It's like the old Benadine we used to use, basically the same thing. And what you're going to want to do is take this out and treat the whole wound with it. So don't worry if you get a lot of it on there, you're going to cover the whole area. And the reason you do this is because there's antibacterial properties of this that will help kill the bacteria and continue to kill the bacteria as you go. The other side effect is this stuff here, as you can see, it's very tacky, and it will also allow the bandage to stick better. So again, you want to wipe the whole area down. If you get a little on the outside or excess, if you can see here, I don't know if she came in close enough on this, you want to make sure you cover it really well. What you want to do then is make an island bandage. Now, I'm not going to use the expensive Leukotape on this. I'm going to use some cheaper waterproof tape. The Leukotape is quite thick, as you can see, and it's a little bit better grade than the actual waterproof tape I'm using. I don't want to waste that for this demonstration. So what I've done is I've used basically the same thing in a waterproof tape, which I wouldn't use for blisters, but it can be used on wounds on the upper body. So I use this lightweight Nexus tape. It's a lightweight waterproof tape, and I've used it here to demonstrate using Leukotape on a blister. This is called an island blister, and island bandage, I'm sorry. What you do is you take your gauze bandage, and here I've taken 3x3s. I like to use the 3x3s, or you can use 1x1s, or you can get them in these little individual pouches here. Loud truck, sorry. And either way, anyway, you want to cut these down, and you want to use the 2-plies that are when you cut them down. These are 3x3s I cut before. You take that 2-ply that you have in there, and you take your tape and you roll it out. And make it quick, I already did it. You place your gauze halfway on that tape, cut another piece of tape the same length, place underneath, overlap the tape together, creating an island bandage, island in the center. Round the edges, because underneath the shoe or underneath the sock, you don't want it to come loose. So you place it over the wound, tape it down, and what this does is by rounding the edges, your sock won't catch it and won't rip it off. And it's just a quicker way of dealing with that. Sorry, it's a little windy out here today. You can use Leukotape like that, and it's one of my favorite things to do. I'm a moleskin guy. If you see my other video, I've used the moleskin. I want to finish up on this because on my moleskin video, I didn't get to show the island bandage how well it works. Now, do you need to put the gauze in the center? It's always a good idea, even if you have a cover on it. In other words, by cover, meaning that you haven't ripped the blister skin off. The reason you want to do that is because you want to protect it from infection. Now, if you put the tape directly over the top of it, when you pull that tape back off, or as you're walking, if that tape comes off, it's going to pull the blister off and you have a bigger problem. That's why I recommend putting the gauze in there. Now, you can put Neosporin on there, which I recommend Neosporin. I recommend the cream for the feet, and I recommend ointment for anywhere else in the body. The reason the cream is the ointment has an oil base, and it will cause the glue and adhesive on this tape to come loose. So I recommend using the cream on the feet. I would use it if you have an open wound. I wouldn't use it if you have a covered wound. You can use a little bit of it on there if you want to, not necessarily necessary. The other thing I like to show is if you, let's say you're out there and you don't have any gauze, bandages, you don't have any way of treating your wounds. So you're gonna make a field expedient way. We did this in the Army. What you do is you take a plastic sandwich bag and you cut a corner of it like this. And so what you're doing is, you've got a 2-ply sandwich bag, you cut the corner, and you're going to put some Neosporin or whatever lubricant you have. If you don't have Neosporin, you can use hand lotion or any kind of lubricant that'll go between there. And basically what you're creating is a bandage that will resist getting any friction on it. It's kind of like an engine bearing, where it puts a barrier between the engine bearings and the crankshaft. It creates a barrier, and it's slippery on this side. Don't mind my tape job. I just did this with duct tape. You can use duct tape in the field. If you run out of Leukotape, you don't have any other tape, you can use this. Just put your cream in the center of that piece you cut off, tape it down around all 4 sides. Do the same thing I did here with the bandage, and it creates a friction bandage, which is really good. And these worked very well in the Army for guys that had real bad blisters in the back area of their heel. It creates a real nice bandage you can make just by cutting the corner, like I showed you, out of the bag. Tape, use duct tape, tape in an emergency. Leukotape if you have it. It's just another way that you can treat the blisters. Okay, moving along, because I have a tendency to get on tangents. Again, I recommend you get 3x3 gauze. You can buy a big brick of them. You can cut them into 1x1 sizes, or the added benefit is if you have a major, not a major cut, but you cut yourself with a broadhead or whatever, you've got a good bandage you can then tape up with your Leukotape, and you've got some kind of adhesive bandage. And here comes the fire engine, great. Okay. The next part of the video that I'm going to show is how you can use Leukotape to treat a sprain or a strain in your ankle. A lot of times you'll roll over your ankle when you step, and you'll strain it in here or sprain it in an eversion roll. Sometimes you get eversion roll, but anyway, there's 3 grades of sprains or strains that you can do. We're not going to get into that. You don't really need to know that. But I'm going to show you a quick, easy way that you can tape this and basically splint it so that you can get out of the backcountry if you need to. Now, first thing you want to do, and make sure that you can, if you have ice or any way you can put cold on it to reduce the swelling, you'll do that. If you're in snow country, you use snow and you can treat it for a while and that without getting frostbite, and put some ice on it. Another thing I might mention, there is a pulse right here on the top of the foot where we splint. If you push right here, come down here, you can see the artery that feeds. And if you put your fingers right here, you can feel the pulse. It's a pedal pulse, that distal pulse that you can feel. If you ever have any injury to the leg, you can check right here and you actually feel the pulse. It's a good way to check the pulse in any kind of lower body extremity injuries. And because we're going to wrap in this area, you want to make sure that you check capillary refill after you get through splinting or taping, because you want to make sure that you're getting blood flow. And how you do that is, capillary refill is you squeeze until you get blanching, which is basically turning white, and you release. It should come back to red like that within 2 seconds. If it takes 4 seconds, you've got an issue. You may need to recheck your tape. It may be too tight and you're getting poor circulation. But again, you squeeze down. She has painted Gothic toenails, so my daughter here, so you really can't do the toenail, but normally you push down till it blanches, release it basically got 1,000 of it, so that's 1 second, real good capillary refill. So because I'm not going to waste all this Leukotape or this waterproof tape, I'm going to use this tape to actually tape up her ankle. You can do the same thing with Leukotape, however I'm not going to waste it. First thing you want to do is get the foot into a normal standing position, because when they walk out of the woods, they're going to need to be in a normal position. Now, if the patient it's real stiff and can't do it, you can use their sissy pole, as I call them, walking poles. Have them slip around their foot as a stirrup and have her or him pull on it and straight. You want the foot straight, flat as if they were walking on it, okay? Because she is not injured, I'm going to have her just hold her foot the proper way. And how you're going to start by doing this, now imagine we're using Leukotape here, so we're simulating. Where the bone is here is usually where, when you twist your ankle and you go outward, is usually where you have your pain to start with. So you're going to start there. And what you do is you start your tape, lay it here, then come across underneath, like so. Then when you come across here, you're going to go across that where I told you Pto pulse was, but you're going to go up to the top, and you have your ankle bone on each side. So you're gonna go underneath. I go around one complete wrap. Now this is gonna be with this blue tape. Now, you come back down the other side here, crisscross, you're making an X in the center, come back under and up. And you always make your cuts at the top because that's wear is down here when you're walking with your foot. If you put your cuts up here, they won't come off as easy under the sock. So that's basically what you start here, go underneath the foot, come back up above the ankle bone, wrap around. I go twice. You can use as much as you want as long as you can tolerate it comfortably. Then come back around and figure X across it. Once you do that, again, check your capillary refill. As you can see, she's got good capillary refill. She's got stuff going. And a lot of times I can still get the pedal pulse. Yep, there we go. I can still get the pulse right there and know she's still getting feed to that lower foot. Now, that's the way you can treat that. Now, if it's a real bad sprain, you can do there's another technique that you can use to add to this. You can wrap 2 rolls of tape across here up on the calf as a stabilizing point, and then you take your tape and you come up under the bottom of the foot like this in a big horseshoe, and you would basically tape up to that point up here onto that tape that you've weighed, put 2 rolls around, and it adds extra stabilization on the back side of the ankle. Kind of helps the Achilles tendon back there pulling on that. Gives it more support. So that's what we do for this one. And the next one I'm going to show you is what you do if you're carrying heavy packs or whatever, and you have basically your arches basically dropping, or you have pain in your foot because your tendons in here in the arch are getting weak. So what you're going to do, I'm trying to think of the name of it exactly, but so another thing you do with Leukotape, if you have Pto Fasciitis, you can treat this here where your arch is falling, or you're getting pain in your heel from that fasciitis. What you can basically do, the same deal I was doing there, only you take the tape and you start here on the bottom of the foot at where your toes are, come around the back about halfway up, come back down, and we're using blue tape, of course, painter's tape. I know it's kind of funny, but it works to save money. And you come up here and you would put the tape down, your first layer, and then you would do a second layer over that, same spot, make a hoop. I'm sorry, you don't want to do that. You want to do it like this, get that nice hoop on it, run it back down, strap it in, you tape the foot there. Then you would come across, now this is blue tape, so it's not going to tape as well. You would run across here with a secured one, and again there you're putting a little bit of pressure on it to relieve the pain. You want to make sure you get some dimples here in the center and rub it down. And of course you would cut it short, and I did here. You'd want it right about where the ball of the foot is. You don't want that wearing off. You'd want to tape that down like that, come across and allow just enough pressure. Check your capillary refill, just enough pressure on there so you're taking it off the foot so that you relieve the pain in there. You can do this for dropped arches, you can do it for whatever. You can crisscross it if you want, however you want. But basically you're supporting it here, putting tension on it, and basically splinting the foot down the center to take care of that fasciitis and to also treat you know, your arches from carrying heavy loads. Okay, that's my video. I hope it came out okay. We had to splice it a couple times and stop it, so we'll move on, and I hope you learned something from it. Thank you.